and a musculoskeletal specialist clinician in primary care practices in London. Today, I have one of my very close friend, Miss Suma Kulkarni. She's joined us from Washington, D.C. in America. It's Sunday evening, but and she's a mother now. She's a new mom. She has recently given birth to a beautiful angel, and Suma has joined us today to discuss about Pfizer vaccine, which she have had recently of the 2 doses. So thank you, Suma, for joining with me today. And Suma, would you tell us where are you based in and what do you do as a healthcare professional? And how was your experience of taking 2 doses of Pfizer vaccine?
Hi, Bhagyashree. It's my pleasure to share this information and my experience with you. So, I work as a physical therapist in Herndon, Virginia. The setting I work in is a subacute and a long term care setting where COVID was rampant the whole of last year. So, I have worked very closely with all the high risk patients during my pregnancy. So I took the Pfizer vaccine. I took the first dose in January of the 19th. And after the first dose, after a few hours of taking the first dose, I experienced a lot of soreness in my left arm. I decided to take the vaccine on my non-dominant arms just so that I can still care for my child. The soreness increased over, I guess, the first 10 to 12 hours. And then the next day around afternoon, the soreness decreased and I was back to normal. And then after the second dose, which was on the very recently on the 9th of Feb, I experienced a soreness, yes, on my left arm where I took the vaccine. It was a little more than than the first dose, but I know it was something familiar, so I knew I expected that soreness. But what was not expected, and I did get a little sick. So I experienced chills early morning, like four in the morning when I woke up to breastfeed my baby, and that increased over the day. I took some paracetamol, acetaminophen here to kind of make it through the day and go to work. But yeah, it all subsided by, like 24 to 48 hours and I was back to normal. Yeah.
That's brilliant. Thank you. Thanks, Sima, for mentioning that. So just to clarify, you had your second Pfizer dose last week, and the duration between the first and the second dose were 4 weeks. And you did not take any time off from work after this first and second dose. Is that correct?
Yeah, I did not take any time off.
Brilliant. Okay, that's really good to know. So, tell me what made you take this vaccine because there's so much concern regarding pregnant and breastfeeding women. So, as a healthcare professional, what were the benefits and risks? What made you take the vaccine, and what were genuinely your concern before you took this vaccine?
So I gave birth to my daughter in September of 2020. So the vaccine hadn't come out yet, but I resumed work in November, and end of December is when the vaccine became available to us at our workplace. And I had to make that decision whether I wanted to take the vaccine or no. And I had genuine concerns because none of the studies or the trials included breastfeeding mothers. So no one knew if a breastfeeding woman had to take the vaccine, what were the adverse effects, or will any harmful effects present in the child. So there was no information about that. So that was my biggest concern. But
Yeah.
I still had to make that decision of whether I had to take it or no. A lot of people around me were like, hold on, just don't take it just yet, wait, make your decision, take some more time, see how the vaccine presents in others, and then see if you want to take it. But I decided to take it. So what I did was, firstly, I just zeroed out all the noise around me. And I knew that if I had to make this decision, it has to be a very personal decision and an informed one. So what
Correct.
I did was I had to do my research. So I went ahead and looked at all the material that was there online. So what I referred to was the recommendations from American Gynecology Association and also American Pediatric Association. And also I read, just the general, what kind of vaccine is it, what are the ingredients of the vaccine, and what are the known side effects of the vaccine from the Center of Disease Control website. And
Mm.
what really stuck with me was on my appointment, with the pediatrician of my child. I had a lengthy conversation and discussion about the vaccine. So she kind of channelized my thought process, and she very simply told me that since you're a healthcare professional, you are at a high risk of getting COVID. And if you get COVID, you're going to give it to everyone around you. So that means I would give it to my colleagues, I would give it to my patients who are healthy and don't have COVID, and my friends, and mainly my family, and my 5-month-old daughter. So that really stuck with me. And that's when I decided that the only way I can protect my family and my near and dear ones was taking the vaccine. So I decided to take the vaccine.
Fantastic. That is very good way of taking an informed decision. And did you feel more responsible? I mean, you're a mom. I'm really surprised you gave birth in September and went back to work in November. So proud, Suma. But did you feel as a healthcare professional you felt that extra responsibility to consider all those facts and took this decision as well?
Yes, so being a healthcare professional and working with the high risk population, um, I felt like it was very important that I needed to get vaccinated. So if I get vaccinated, I protect everyone around me, and which means that I don't give COVID to people, and my patients, especially my patients, who are in the vulnerable population, and
Yeah,
also I can care for them better. If I'm healthy, I can deliver good quality care to them. So yes, and that's how I
fantastic.
made the
Thank
decision.
Yeah, no, that's brilliant. And because I think you are among the first few healthcare professional in America to get the vaccine, would you tell us what is the hierarchy or criteria are for being followed in America at the moment? We as you know, we were the first country in the world. In Britain, we've started the vaccination. We follow a hierarchy. So if you give me like a brief details, how's things there?
So it's very similar to how you guys are doing it in the UK. We do have a hierarchy here as well, mandated by the federal government, and all states are doing it based on the CDC, Center of Disease Control recommendations. So we do have a phased rollout of the vaccine here as well. So I think we're still in phase 1 right now, and we're doing vaccinations for our healthcare professionals, our patients who are above 75 years of age, in long-term care residents and in the community too, and from 16 to 65 who are having any comorbid conditions at this point. Yes, so it's still we're still in this phase right now.
Yeah, and obviously US is massive and huge. It will take some time to reach the general public. No, that was brilliant, and that was really helpful. I'm proud of you again. At least you've shared your evening. You're a mother, and you're sharing your experience, which and it's a bold thing to come and share your experience as a breastfeeding mother. So thank you so much. Thanks again. You take care of yourself, and hopefully we all healthcare professional join hands to eradicate the virus together.
Thank you so much, Bhagrashri.
Thanks so much. Bye.
Bye.